While Vance will lead us in the pledge thereafter, and we will be praying. If somebody's uncomfortable with a prayer, you can stand outside and rejoin us in a moment. Otherwise, Kurt.
Our Father in heaven, we're grateful to be here to watch our local government work, and we pray they'll be inspired to make the decisions that are best for the people living here and for the community, and we ask that we'll all travel home safely afterward in the name of Jesus Christ.
Amen.
Please stand, repeat the Pledge of Allegiance with me.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
We appreciate you all being here. We have an agenda, Council.
I'll make a motion, we approve the agenda and also at that time table item 8A.
Motion made by Jeffrey.
I'll second it.
Second by Diana. All in favor?
Aye.
Opposed? Minutes from August 21st, 2018. Any questions on the minutes? Apparently not. We need a motion.
I'll make a motion that we approve the minutes. I'll second that.
Motion made by Brett, second by Lyle H. All in favor?
Aye.
Opposed? Years of Service Award. Nels Jensen is not here. So does that mean he doesn't get an award?
We'll split it.
Okay. We'll buy pizza next week for him. 5 years, I believe, from Nels, isn't it?
Yep.
All right. We'll get it to him. Proclamation declaring September 2018 as an opioid prescription abuse awareness month. Chad Hunt, Laurie Weston, and I don't know who this other guy is.
This is Jordan Miller. I'm with the Bear River Health Department.
Okay, we're glad to have you with us.
So, do I need to sit down, stand up? Does it matter?
You come over to the speaker, and
Okay.
if you wouldn't mind.
All right. I guess I should come over here so you can hear me, right?
Yes.
By the way, I'm glad you bought pizza to commemorate me coming again. That's always nice.
We heard it, heard your comment.
I know. You saw my name on the agenda and thought we need pizza and Dr. Pepper. So we came last year and presented a resolution. You guys accepted the resolution and partnered with us to recognize opioid prescription abuse awareness. And we wanted to come again this year and continue that effort of recognizing the need for awareness around opioid prescription abuse. It's still something that's very rampant. It's still something that's considered a national epidemic. It's still something that's very much in need of addressing.
Better or worse in our valley?
Yeah, that was my question.
It is getting better. So we're making progress. I don't know, do we have numbers for?
I don't think we've got them yet.
So
we
we're
just kicked it off last September, so
yeah.
hopefully.
So we're still trying to get numbers for how we've been doing. Intermountain Healthcare has a goal to reduce it by 40%. And as far as Intermountain Healthcare for the state, we've already reduced the amount we prescribed by more than 20% for 2018, which has been incredible. So as far as our community, we're doing what we can as far as making changes to how our providers prescribe pills, the number of pills that are prescribed. And we're really just continuing our efforts of, of having people make sure they talk to their doctor, ask them 5 questions, and following the speak out, opt out, throw out model of speaking to their physician, asking these questions of what are their other options if they need to take an opioid or if there's something else they can take. Opting out and looking at other opportunities to do something different, like doing physical therapy, taking something that's not an opioid and not as likely to be addictive. And then, of course, once they're done with any opioids that they do take, that are required or that they just need, to get rid of the leftovers. That's one of our biggest things. Is a lot of people. I'm sure we could all go back to our homes, into our medicine cabinets, and pull out a bottle or two of Loratab or whatever.
Not at my
And,
house.
Not
Give them to me.
And see, that's the problem.
Yeah.
And in a lot of our communities, we have a lot of sharing, so not saying that you're the problem.
I've got to ask another question.
Yeah.
The doctors are working really rampant at this. How about the dentists?
I hope they are too. So,
But I think that's another leak.
Yeah.
yeah,
Which concerns
that's agreed.
me.
That's agreed.
Yeah.
And so that's a good point, and maybe that's the next place we need to reach out and start working with our dentists. We have worked with our pharmacies, and they've come out. So another thing that we've done, aside from just doing these awareness things and trying to reduce the amount of pills, is we've also done a lot of training for naloxone kits, which that's the medication that if you suspect someone has overdosed, you can give them that, and it's a life-saving measure.
Has the price of that come down? Because I know we were supplying our police and stuff with that.
Naloxone. If you get in touch, are you guys still doing a lot of naloxone?
Yeah, it's Megan Bowman.
Okay, so there are avenues with the health department where you can reach out and see what you can do as far as.
Because it expires, doesn't it?
Mm-hmm. That's correct.
I
So
mean,
you've
if
always
they
got to
haven't used
replenish.
it, then we're.
Yeah.
So.
Or, and a lot of what the health department's program does is the nasal. We've given out a lot of the needle and vial, the syringes. And so there are ways out there that you can get naloxone. I know a lot of Intermountain's programs are geared more towards the public versus a lot of our agencies. So there are stipulations for giving it out free of charge, but we do have some, and we have done trainings where people can come get naloxone kits free of charge. So that's another way that we've been reaching out. So we're just continuing to put that message out there. We don't have the great big pill bottle chandelier.
Is it
to
gone?
put in everybody's
That was
faces
cool,
anymore. But yeah, we had it. We did take it down in February. Just there are a lot of other people that
It
wanted as
travels
well.
around the
Yeah.
hospitals in Intermountain.
Oh, did it?
It's been making the rounds different places. But we loved having it. We loved the conversation starter that it was for our community. And the reason that we're here tonight is we don't want that conversation to die. We want to make sure that we're continuing in our communities to have those conversations and to talk about it and to continue to be aware that that's a problem that exists and not sweep it under the rug. Do you have any questions for me? Do I need to read the resolution, or have you all looked over it?
Whatever trips your trigger.
If you want to read it, if you want to read it.
It depends. I mean, how early you guys want to get out of here.
We'll sign it.
Okay.
Yeah.
It's less than a page, so
Okay.
I'll be quick. We've talked about a lot of it already, so. Again, we want to thank Jordan Miller and the Bear River Health Department for being a good partner, and we also want to thank you guys for being a partner in this. But whereas more than 7,000 opioid prescriptions are filled in Utah each day, more than 6,500 prescriptions at Bear River Valley Hospital and Bear River Clinic between 2015 and July of 2017, and whereas it can take as few as 7 days to become addicted to an opioid prescription, with Box Elder County ranking in the top 10 states for adjusted rate of opioid-related deaths per capita in Utah, and Utah ranking 4th in the nation in prescription-related deaths. Whereas there are 24 opioid-related deaths per month in the state of Utah. Whereas as many as 30 to 50% of pills prescribed are never consumed by the individual who filled the prescription for the reason they were prescribed, and more than 2/3 of addicts obtain their pills from friends and family storing leftover prescription pills. Whereas there has been a national opioid crisis declared, whereas Bear River Valley Hospital and Intermountain Healthcare have been working to reduce the amount of opioids prescribed to patients by 40% and have currently reduced them by more than 20% in 2018, whereas Intermountain, Bear River Valley Hospital, and the Bear River Health Department have worked to promote substance abuse and provide education and kits for administering naloxone to community members and groups to help reverse drug overdose. Now therefore be it resolved that the members of the Tremonton City Council hereby recognize the month of September 2018 as Opioid Prescription Abuse Awareness Month in Tremonton City. Be it further resolved that Tremonton City Council urges all residents to speak out, ask their doctor or dentist about their risk for addiction, opt out, look for alternatives to opioids that may be more effective and have fewer side effects, and throw out, properly dispose of unused or expired prescriptions at the Tremonton City Police Department. And that's another piece that we want to commend you guys on, is being our resource for giving people an option to dispose of properly their unused medications at the police department. I know Chief Vance was a big proponent. Chief Vance was a big proponent of the drop box and getting rid of prescription opioids in a proper manner. And I know Chief Furtick is probably in the same vein of wanting to make sure residents throw out their prescriptions and get them off the streets, but do it in a manner that that doesn't harm other things in other ways, such as getting in the water supply or whatnot.
So if we're in the top 10, are we like closer to 10 or are we closer to 1?
Closer to Closer to one.
Yeah.
Are we
Quite
serious?
similar, yeah. So, and we do have, so this is something that Intermountain did earlier this year, just as part of our initiative. In the Deseret News, these came out to everyone who subscribes to the Deseret News. It's just a bag that you can put those leftovers in. It makes it easier just to take them all down and dispose of them in the drop box. So if you guys ever need, if you want us to leave some of these here, we can, just to help people do that. And we've got plenty of resources here that we'd like to leave with you guys. We've got information pamphlets, both in English and Spanish. Posters that you can put. I think these would be awesome over by the drop box or wherever we can.
Can we put some up on our front desk up here too?
Absolutely.
We could maybe put some over in the food pantry and
I think that's a great idea.
maybe the senior center. We've got.
Fantastic.
Oh.
So whenever you guys can make this, get this message out and make it available, we would greatly appreciate that and be excited. We're excited to have you guys on board with us again. And also, I want to turn the time over to Lori for just a second, just to say thanks for another initiative we've been working on.
Just wanted to reach out and say thank you for your partnership on the Kevin Hines event we're holding. He is a suicide survivor and a mental illness advocate. I know we're here talking about opioids tonight, but really opioids are really the things that people are taking when they've got a mental illness or they're coping with something. Opioids is what they turn to. This is a great speaker. He talks about his experience, his struggle with mental illness and the pain that he's going through, whether physical or emotional. They're trying to deal with the pain any way they can. So I wanted to thank you. We've also got a lot of our other city partners on this initiative with us. That's September 20th. At the Bear River High School at 6:30 p.m. We are also working on having an assembly that day to try to reach as many adolescents and teens as we can in the county. That includes Box Elder County high schools and middle schools as well. So we're working with the school district on that so we can increase our reach across the county on what we're doing there. So thank you.
Thank you. Health Department, do you have something to inspire us with?
Nope, just here to support.
Counseling.
So in closing, sorry, I didn't mean to interrupt you, Roger.
You're gonna go to hell for that, you know.
We thought you could go one night without swearing.
I did.
Well, if that's all it took for me to go,
Yeah.
I was consigned there a long time ago. So just as we close up, before we have you guys consider adopting the resolution, I just wanted to again you know, we're at Suicide Prevention Month. I thought this fit in very well to mention this. Along with that, we're also looking at bringing in a piece into the hospital for Suicide Prevention Month, and I'll reach out to you guys as soon as we have that available. We'd love to have you guys down to come see that. It's going to be a hope wall, and we'll kind of let that be what it is until it's there and we show you guys how it works and what it is. But again, we appreciate all your help and support in all these initiatives, so thank you.
Thank you very much. Council, we need a motion.
Well, I'll make a motion. Is this a resolution? Proclamation, yeah. I'd like to make a motion that we allow the mayor to sign the proclamation declaring September 2018 as Opioid Prescription Abuse Awareness Month.
Motion made by Brett. Second by Lyle H. All in favor?
Aye.
Anyone opposed? Thank you.
Thank you.
Thank you. Do you mind if we take a quick picture again this year?
I just love my picture.
I know you wore your picture shirt today.
Get it right here, Frank, photobomb you, will you?
Yes.
Well, I want all you guys in.
Oh, no.
Yeah.
And we'll have you know that you've been on camera the whole time.
Yeah.
Fantastic.
This is going live now.
It's awesome.
So the time I pick my nose is probably on there too.
Yeah.
Could be.
Okay, Chad, I don't know where your camera is in all of this.
My
Get all of you in it.
camera's a bit of a mess.
There you go.
Here, I'll take it.
All right.
Why don't you get all of you in it?
I'm fine taking it.
Whatever.
Good try.
We gotta get Jordan.
This is
up
one of the
here.
few times I can boss her
Why don't you,
around.
why don't you get in the picture?
What do you want? Here, sign.
All right, let's get these out here. You guys aren't coming.
I'm-
No.
We can let him be in the background.
We want the main counters,
There we
yeah.
go.
All right.
You want to stand so they can
So that we can see him behind us here. Thank you.
Thank you. Thank you very much. Appreciate it.
Thank you, guys.
Thank you, Roger.
Thank you very much.
Thank you.
They hate me.
You're awesome, thanks.
Thanks, Jeff.
Shake your hand, even though you're
Appreciate
in a
it.
picture.
You got it.
I am in the picture, you watch. Oh, yeah.
How many bunny ears?
Uh,
Is it more like moose antlers?
Even I was picking my nose.
When you see this real shiny spot on your
That's
camera.
me.
That's just natural,
It's
right?
true, yeah.
Thanks so much.
Thank you very
guys.
much. Public comment. This is an opportunity for the public to address the city council. Limit your comments to 3 minutes, and if there's anybody would like to, this is your time.
I won't go through the whole agenda. We just wanted to,
Introduce yourself.
Yeah, state your name.
sorry, Krisha Blankenship.
Tony Blankenship.
Can you say where from? I
And
forgot
your
how
social
this
security
all
number.
goes. But we just wanted to bring to your attention that where there, and I know it's amended, but there is already tattooing on Main Street right now. Because anytime you break open the skin and ink is applied to the dermis layer, which microblading permanent makeup is, that is considered tattooing, which you guys have it on Main Street. Now, the only thing with that is, since it's already on Main Street, would you guys be opposed of us being on Main Street, or would you like us to be like back away from Main Street? Because we have two locations in mind. One is at the end of Main Street, which is at 137 West, down by All Reds Auto Body. And the other place would be behind the Bank of Utah. And those are both commercial areas. And also, because we'd like to bring up that where tattoos have a vault and money is leaving town because people are driving to Salt Lake. They're driving to Ogden. and they're getting tattooed there, which means the town isn't making money. Because when people get tattooed, they have to wait. Usually people come with their spouse, their boyfriend, girlfriend. They get bored waiting for an hour or two, so they'll go shop, they'll go get something to eat, but money's leaving, and we'd like to keep the money here. And this is our business, this is how we raise our family. Been doing it for the past 15 years. So it just like, not to be a jerk, but move it along so we can put food on the table. But we'd just like to point those out. Oh, and also too, if you guys are worried about parking, also, at the most, there'd be 1 or 2 vehicles there at a time. Versus, I mean, there's a lot of things on Main Street that have many people, like Domino's. I mean, how many people are in and out of there, and they're directly on the corner of Main Street. But parking wouldn't be an issue either on both locations.
Sorry. Plus the one location we were looking at on Main Street has parking in the back. So, which is our parking. Just to keep in mind. I mean, we just wanted to bring that up, just so you guys are aware of it.
Just a little.
Since we couldn't earlier.
Thank you.
Any questions? Really,
Cool.
guys?
Anybody have questions?
Thank you.
All right, thanks.
Appreciate it.
Thanks, guys.
Anyone else? Yes.
Ben Greener, resident of Tremonton. I'm also on the planning commission. I'd like to, we discussed what Sean talked about last week in our meeting, and I'd like to support that. We're developing areas that have one kind of rules. Then they come in and ask for those rules to be changed. They don't match what we've done in other places of the city. So I think we should develop an even approach to our zoning that allows for highway signs and that. It's just this overlay thing that we keep doing. We've done 3 or 4 times since I've been on the commission. It's just not fair to the people that come in. We zone something, a certain thing that doesn't allow pole signs, it doesn't allow this, and then we end up giving an overlay that does. It's just an uneven approach to zoning. So I feel you maybe should task the commission to come up with this, give them a time frame and some kind of guidance on a more even approach to, to our zoning. We've done like 3 or maybe 4 overlays. When the auto zone, that development come in, they want a different kind of signs. Well, that should be the whole Main Street then. If they get those kind of signs, maybe all of Main Street should be zoned the same. If Stokes Trucking and Warner Trucking get this big sign, see, when they came in, they were a manufacturing and distribution zone, no pole signs. But now they've asked for this overlay. And if that's appropriate for there, then it should be all the way down the freeway. So just a little clarification, maybe set us in some direction. And they misspeak anything, I think that's what we talked about, and I think it's just a better approach than these overlays. And on tattoos, 30% of Americans have tattoos. So that little research I did whenever looked at that, it's a pretty common thing, so probably should accommodate that. Thanks.
Thank you. Anyone else? Your opportunity is gone. Which one did we do?
A.
A?
Yeah.
Discussion and consideration of approving resolution 18-42, adopting the first Tom Green Estates East Phase 7 subdivision development agreement. Sean?
Yeah, I didn't get a chance to talk to Lyle about this. And I think it's ready, although there is one other item that I'm not sure is included that should be, which is the dedication of water shares to the city. I don't know if that's been done yet or not. It shouldn't have been recorded without that, but I don't know if that's been taken care of. So if we need to put that in the agreement, then we'll need to table it if it hasn't already been dedicated to the city, those shares. But just as a way of background, this specific development agreement item, the special conditions, talks about paying Lyle essentially the cost associated with his installation of upsizing storm drain system through his development to accommodate future development that will occur to the east of him. And essentially our engineer went through, and Lyle, I don't know if your engineers had a chance to review it and check just to make sure you feel comfortable with the items. I talked to Chris. Chris said that he erred in favor of the developer as far as, you know, trying to determine what should be reimbursable. And so if you scroll down further, you'll see that actual table. Yeah, there it starts to appear. What we don't know, this is the engineer's estimate, which may be high, and it may be low. And so what we've asked essentially is for Lyle to bring us the actual costs so that we can make sure that we pay them fairly the amount. But we're estimating it somewhere in $21,000. This is all impact fee eligible funds, and so we would just essentially pay Lyle that cost, which should be approximately in that $21,000 range, $22,000 range.
Mine is all blurred out. I don't know.
Can you see this one? It's probably hard to read.
Now I had some other questions too that,
Do we need to table it?
probably.
Okay.
And until you talk to Lyle about it?
Yeah, we need to.
I'll make a motion, we table item 8.
I'll second it.
Motion made by Jeffrey, seconded by Brett. All in favor?
Aye.
Opposed? You good with that, Lyle?
Which Lyle?
Pick one. Both of you good with it? Okay. Okay, discussion and consideration of adopting ordinance number 18-10 designating and establishing regulations for weight-restricted loads within Tremont City. John?
So this was discussed at our last city council meeting. I did reach out, provide this this ordinance to Val, and I sent it to a general mailbox, but Steve Bench had his, Steve Bench had his direct email, and the communication that I got back from Steve Bench and him corresponding was essentially he just acknowledged that he received it, didn't say anything.
He was in our planning commission meeting, and that I brought that up.
Oh, good.
And he seemed in support of it. He didn't balk at all. In fact, it was discussed about having signs in the right place so people don't turn up and go up those roads, and that was part of his argument for having proper signage in front of his building so that the people coming down the appropriate roads knew where to turn and everything. So I felt like I didn't think he had anything that negative about the move.
Good, because it had some, as you know, we had talked about it all through the development
Right.
process. So I did not reach out. I thought about this after the fact, but I did reach out to UDOT. They also have a facility on the west end of this street, but by virtue of our consultant already communicating with them, at some level UDOT knows. I don't know if their local shed manager or administrator knows, but I still think that there's access for them to go around using the interstate system. So the other thing is we did add one more exception. If you scroll down, then it's just to make it clear if there's any vehicles that are traveling to a home or business, keep going. We're getting pretty close right there. No, I'm sorry, scroll down one more. So I added 12.
Is it going to be hard for you to police that?
No, I mean, they may still get pulled over,
Okay.
and as long as they've got the right explanation that it's an exception, they'll be fine.
I've been driving up that direction a lot lately, and there's a lot of trucks that come down that road. So it may require a little bit of enforcement to start with.
Well, there will be signs, as you know. I mean, that's one
Yeah,
of the
that will
requirements
help.
of the state code. And
Yeah.
UDOT, our consultants working with UDOT, hopefully to put the signs either on the interstate or at the worst case scenario would be on the off-ramps themselves. So they should have plenty of notice to.
So they don't get on the road and decide they have to turn around when they're on the road.
That's what we hope, yeah.
Brett's probably been going on there with a big rigger anyway.
Any further questions or discussions, council? Anyone want to make a motion?
I'll make a motion that we adopt ordinance number 18-10.
I second it.
Motion made by Lyle, seconded by Diana. Roll call.
Brett, aye.
Lyle H. I.
Jeff, aye.
Diana, I.
Lyle Vance, aye.
Okay, thank you. Discussion and consideration of adopting ordinance 18-12, approving an amendment of to the revised ordinances of Tremont City Corporation contained in 8-516, inflatables, recreational devices, rides, mechanical bolts, etc. of Chapter 8-500 Tremont City Parks. Mark, are you in charge of this one, or Sean?
Can speak to it. Simply, I received, there's a network that occurs, and network meaning other cities, and we exchange information. This is something that, a question that was asked by another city, and cities responded about what kind of activities they either allow or prohibit that could pose certain risks to the city. And we had a pretty good list, but there were some other ones that were brought to our attention by virtue of this exchange of information and coordination that occurred. And essentially it was ice blocking and water slides. And why we don't have any ice parks that would really facilitate ice blocking, I just thought why it was fresh and apparent that we should put it in. And if we ever do develop a park on the hill that has a hill in it, that would already be.
I know right where you could do is start that trail over there.
That's true. You can make a toboggan run out of it.
Yeah.
So simply, I think it's just adding those two items to our existing list.
Council, need a motion.
I'll make a motion that we adopt our ordinance number 18-12.
I'll second it.
Motion made by Lyle, seconded by Brett. Roll call.
Brett, aye.
Lyle H. I.
Jeff, aye.
Diana, I.
Lyle Vance, aye.
Thank you. Continuation or commencement workshop agenda items. A
I think we
continuation.
did it. We discussed them all.
I think we did, didn't we?
Yep.
Okay. Calendar items. Review of the calendar. Any calendar items?
There's some items to be aware of. Barbecue tomorrow at the North Park. Of course, you're invited.
Starts at what time?
5:30.
Is it 5:30?
Okay.
And then Utah League of Cities and Towns Conference. Everyone knows who's
Coming up in
registered.
September. Coming up right away.
When is it?
Is that 2 weeks?
2 weeks.
Okay.
Week from tomorrow?
Yeah, a week from tomorrow, 12, 13, 14.
And then follow-up items, we talked about mission and value statements earlier, as you know. And then we're working on putting together some information on the credit cards, and we should be able to present some of our findings next month.
Any other calendar items? Yes, there is a calendar item we need to talk about.
Oh,
Friday.
Here it comes.
Friday.
Is that Friday? That was Thursday.
Friday. Friday. Ferris.
You got Ferris Bueller up there?
Yes, this is Ferris Bueller. And it seems I have this printed off for everybody to review.
There's Roger.
Brett.
So you gonna be that part?
I was hoping you would.
No. You look more like Ferris Bueller.
Lyle doing that.
Lyle's gonna love it.
You got me in a dress like that.
So you doing that, Mayor? Are you gonna be the one singing?
Oh, no, we're all singing.
That's you. Wow. You're gonna do that. You should.
Not because I want to either.
And what I'm thinking here, since you don't know what we're doing, there's Peach Days coming. And we have been, Brigham City challenged us to a lip sync. Okay, whether we like it or don't like it, I don't like it. It has nothing to do with that. And we beat Brigham City last year, so we're doing it again this year. And nobody came up with any other ideas there were a few, Rhodey came up with some inspirational kind of things, but we had to edit them so bad they couldn't. So, at some point in time, we need to, we're out of time, this happens Friday. So, maybe tomorrow night after our little party, we can get together and run through something, just a minute.
I think I'm gonna be farming. Sorry.
Well, you wing it, Diana.
Okay.
Okay. So we don't have a lot of, I looked at this and we don't have a lot of makeup and dressing kind of things to do. And I have a copy of the thing so you know what you're lip syncing. And just come ready to twist and shout. And as I thought about this in here would be a great audience participation event.
Yep.
Oh, you're gonna get them to stand up?
Absolutely.
And dance with us.
Absolutely. So if that's all right, we'll kind of plan on it. And
Yeah,
if you
I'll
want
just
to bring
disguise
your wives
myself
to
really
dance,
well.
You can do whatever, right? It sounds awful.
And it's Friday night?
Friday night.
Friday
Or
night,
Thursday night.
what time?
I think it's at 7 o'clock. I will let you know for sure. But when we're doing this, since we've done it for Brigham City, it's my idea that, Mark, this perhaps would be something that you could put in Tremonton City Days. A lip sync duo. Or they could just come and sing to us. Huh?
Twice a year?
Hey, Terry said you guys could practice it tomorrow at the city party to see how they did it.
Can you come up with something more degrading that you can challenge them to? That
We'll find
for
something.
Tremont City, like milking cows or?
There should be something. So anyhow, I'm sorry to ruin your evening. It only lasts for 2 minutes and 21 seconds. So it'll be over soon. City manager report. Sean, anything?
Yeah, we did finally get our certification for our intersection improvement project on Main and 1000 West. So they are advertising, with the advertisement and collection of bids will probably occur for a 2-month period, and then they'll make a decision and construct in the spring.
Okay. Anything else?
Working on our mural. We got our mural bid project. 2 bids came back in. And
Really?
Yeah.
This is for the rodeo?
What were they at?
What price point? Just right around budget, the 9,000-ish.
Both of them
Did
closed?
they award it today?
So that'll actually come to the council for the final decision. The Arts Council met, made a recommendation, which is getting forwarded to you.
Okay.
So next city council that should be on.
Okay. Land use report. Brett?
John.
John?
You know, I really can't think of anything that we've been working on. We haven't had any meetings.
You haven't had any meetings for a couple of weeks now, have you?
We haven't. So, been working with Craig Adams about trying to finalize this development agreement. But that's something I keep in mind as far as an active conversation I had.
Any department heads that want to comment? Paul?
And I do enjoy working with the council. I just am passionate about stuff. So just so you know.
We've never got passionate before.
But no, what I was gonna mention is I'll be gone next city council meeting, so if we could maybe pass that, the water rates issue on to the first meeting in October, where I'll be back, since I like to be a part of that discussion.
You guys good with that?
Yeah, sure.
And that'll give us time to work up several scenarios and get to you guys a week or two prior to the meeting.
All right.
So you have time to look through what we do.
Okay.
So that's all I have to say.
Okay.
Thanks, Paul.
Appreciate it, Paul.
We do appreciate it, Paul. I brag about you to everybody. I tell them, hey, Paul knows everything under all of our streets. He is a good man.
That don't go for Curtis, though.
Curtis don't know what's under our street.
He knows of it.
But he knows a lot of other stuff.
Council reports. Brett?
I thought that Ben Greener had a good idea about, when we said, let's pass that down to the planning commission, and could we task them to have that back to, I think we ought to pass it down to them and task them to have that something back to us within a reasonable amount of time.
I think that would be a good thing.
I thought that was a great suggestion. And, I think it's a bigger scope than it's not a one meeting thing, and there's a lot to be discussed, but I was wondering if we could task them to have something back like by November 1st or something like that. What's your thought, Sean?
Yeah, I think that'd be great. I'm not sure if you want to go and just have the planning commission, look at it, if you want to take a step back further and try to create this vision, and then, with the vision in mind, create the ordinances to enact the vision, or if you just want to take a look at our current ordinances and make changes to them.
Well, I think the vision needs to be there, and I think it needs to fall within line of what we're trying to do with our greater goals.
Can we go faster than that? Or like these people would like to have an answer?
For
Well,
this,
with the
yes.
conditional part, couldn't that?
Yeah, that could be discussed faster, but, it would be nice to task them on, yeah, you're right. We need to we need to work towards a vision and towards a master plan, and that can't be real fast.
Yeah. I mean, if they see some current items that they think need to be changed because of inequities or, just deficiencies within the code, that's something that could occur fairly quickly. But, if you're going to go through the process of creating the vision and doing something at a larger scale, you might want to withhold, making a lot of changes until we figure that piece out.
Yeah.
Anything else, Brett?
No.
Lyle H?
Don't have anything. I just a little report. Still have quite a bit to do with the county fair, and just as a matter of interest, the junior livestock auction, which there was almost 800 youth, 800 animals participating in that program, and from all over the county. It brought about $1.2 million.
Is that about the same as last year?
We haven't got the final tally yet, but it's going to be really close to last year.
Grand
Awesome.
Champion steer, unreal, huh?
Yeah.
Who took that?
IML.
Awesome. Anything else, Lon?
Oh, no.
Okay. Jeffrey?
No.
Diana?
Got the share thing that we need to do in closed meeting.
Yes, we have a closed meeting after. And I had something else when I was going out. One of my favorite times the whole year is walking through the Box Elder County Fair. And I was chatting with a Boy Scout out there. And scouting in the LDS church is changing. Maybe you've noticed that. Okay, just a little bit. And his idea was, okay, since there's a group of scouts that will still really want to be scouts and get their eagles and do that kind of stuff, he was wondering if Tremonton City would help sponsor, or not sponsor, but provide a place for Boy Scouts to meet, perhaps. And so I'm bringing that up to you. I can't see a minus in it. I can see nothing but a plus in it. Wouldn't be expensive. Wouldn't cost us probably anything, but it would provide a place for the Boy Scouts.
Would be a good place to.
It would be a place that, if that would be all right. And that won't happen until January 2020.
Yeah, we just need, you know, if Girl Scouts come to us or any other
To make
organization
it
comes to it and wants, we would need to be able to offer the same thing, so we need to be
If
conscious
that's all right
of
with
that.
you guys, at least to think about it now. So the seed was planted, okay? We need a motion, we need a little closed session work.
I'll make a motion, we close this session and go into closed session.
Motion made by Lyle H.,
I'll second it.
second by Diana, all in favor?
Aye.
Opposed?
Turn off.
Thank you.